Let me just pick up on one point that blasted by you, one very important point in Vitor's talk. He talked about a benefit cost calculator for retrofit. It sounds like jargon, but it's probably one of the most important things to come out of this entire effort. Unless we can talk to people about whether or not the cost of making their homes and apartments safer is worth it, nobody will do it. And it turns out to be a very difficult problem because you have to know the likelihood of shaking. You have to know the consequences for that building. You need to know the cost of making that building stronger and what that buys you in safety. And it turns out it also depends on the depreciation or loss of value of the building with time, how long you're going to live there, and whether or not you can get a loan to get the retrofit in the first place, which makes it cheaper. And this tool and research has led to the realization that if you just, in most modest economic areas, if you just consider the cost of the building, retrofit doesn't make sense, which astonished us. But it turns out that that's not the full problem. If that building collapses, and the breadwinner dies, or family members dies, or a mother dies, the economic consequences of that earthquake gets enormously amplified for generations. So the tool allows us to do something important so we can talk to people about convincing them, not just governments, but homeowners themselves, should I retrofit? But the tool also exposes us to a deeper understanding of the problem. It goes beyond physical damage and dollars. It goes to the social fabric of our communities. And that's where Christopher Burton's work comes in. I'm not ready for you yet. Christopher is the lead of our social vulnerability work. And this is perhaps the hardest nut to crack, but undoubtedly the most important. If you think for a moment of the magnitude 9 Tohoku earthquake in Japan, and you compare it to the magnitude 9.2 2004 earthquake in Sumatra, they have similar levels of damage from shaking and tsunamis. But the consequences of those earthquakes are entirely different. And it's not just because of the wealth of Japan compared to Sumatra. There are other factors, like the absence of corruption in Japan, or the willingness of Japanese citizens to collectively sacrifice for the good of one part of their country. So these, or the age of the survivors. So these multiple factors need to be considered if we're going to understand the true consequences of earthquakes. And that's the very difficult job that we've given Christopher. And as you'll see, he and his group have made enormous progress.
Essentially, I'll start in the same way as acknowledging that this is a project that we've been working on for over 2 years now, and it's been the product of a very fruitful collaboration between us, Jim, and the Center for Disaster Management and Risk Reduction Technology, that's CIDM, in Germany. And along the way, we've had the opportunity to work not only with CIDM, but other researchers at the University of Heidelberg, and even in Nepal, working very closely with the National Society for Earthquake Technology, which is NSET. I have had the opportunity to put the names of the people who have actively contributed to the project. I hope I haven't forgotten anybody up there, but thank you for everything and for getting us to this point. In working with Jim, I've had the opportunity to visit the wonderful country of Nepal several times, and I've taken thousands of photos. And what I like to do is tell a story with photos. And this one presents a good one, because if you look at the top right, which is your left, you see a series of residential structures, essentially a neighborhood that looks like it could be affluent compared to some other areas in Kathmandu. You don't have high population densities, but you can compare that with the photo that's sitting right next to it, which is a shanty town. And what I like to say is same event, very different consequences, which is something that Ross touched upon with different events, but also different consequences as well. And there's various drivers for these different consequences, not only consequences and damages, but also the ability to recover or to mitigate against the disaster impact. And some of these include the elderly, also different races and different class, people may be undermined. We also have the infrastructure itself, which you can see the infrastructure in this particular area many times is stacked up on top of each other. We can see this one is starting to lean over, but it's not just the buildings. There's a certain amount of population density that plays into this, and there's decision making that plays into this that needs to be captured. The photo on your far right is an example of a road widening project where the facades of the building are cut off, though the front of the buildings themselves. The engineers at this point aren't even sure how this is contributing to seismic risk, and studies are being done. But there's a decision-making process that went into cutting the facades off these buildings, and this is something that we really need to understand. So it's not just about the hazard and ground shaking, it's not just about the loss to buildings themselves, but it's about the people who inhabit those buildings and who make decisions that directly affect the risk. And that's exactly as GEM is what we're doing. We're trying to see this as the entire bigger picture in a more holistic way and develop models to do this. And this is where my concentration is social vulnerability. I define it often as characteristics or qualities within social systems that create the potential for loss. But another important part of this is resilience, and this is the ability of populations to prepare for, to mitigate, to react to, and to respond to following an earthquake event. And here's an example of some of the work that we're doing using Portugal. This is an end-to-end analysis of what we're terming integrated seismic risk, which is the combination of these social elements with estimates of physical risks themselves. The first map you see is a map of average annual loss for Portugal. What you'll notice right away is the higher areas of average annual loss are in the bigger cities such as Lisbon, which are right along the area of high seismic hazard. The middle map is a social vulnerability index. Essentially, this is a composite of various variables that the literature says that we need to really be looking at in terms of quantifying vulnerability. This particular model is 36 variables that cover population, economy, infrastructure, education, health, and governance. What you'll notice right away on this one is you tend to have an urban-rural dichotomy. You don't have the highest socially vulnerable populations in urban areas such as Lisbon, but you have them in the rural populations, which are areas, of course, where you have lower education, lower incomes, less access to hospitals, etc. But when you there's various different ways where these maps can be mathematically combined, and this particular one that was chosen here is based on looking at social vulnerability as an aggravation factor to the risk itself. So it allows you to see this compounding element of the social factors, which in many ways you can see the areas of high risk, and now you're starting to see that combined with the social vulnerability, so you can really start to understand where you have the areas that are of highest potential loss, but the areas where the people are least likely to recover or to withstand the shocks from these losses. And this is areas where more, of course, research is needed, and areas where potential disaster risk reduction protocols can be put in action to reduce risk and increase resilience. Now, how do we represent these factors such as social vulnerability and resilience within the broader GEM? And the first element is through data. One of the first steps we've done is start to compile these very large databases that are specifically aimed just at social and economic vulnerability. So these aren't just population variables, but these are variables that cover population, economy, infrastructure as well, health, education. And it's looking at it in terms of what are the drivers of social vulnerability, and we've developed databases around this. We've done this at the national level for the globe, a database that started off in excess of 1,000 indicators and is now down to a little less than 150 that are essentially what we consider the drivers as experts, but also ones that are statistically robust, and there's been a lot of mathematics and statistical analysis that go behind these. The second database that we've created so far is for the Asia-Pacific region in 22 countries in the Asia-Pacific region, and this is at the subnational level of geography, and these of course are available and they're running and usable within our tools. And in addition, these databases are already being used for exercises outside of the realm of physical risk, but looking at shelter capacity and shelter modeling, but also looking at indirect economic loss as well. So they're being put to good use as we speak. Now, how do we operationalize these concepts? We have data, we have theory, but how do we actually operationalize this? And one is through tool development. We've developed, and you've heard about this several times, but a QJS plugin that is what we call the Integrated Risk Modeling Toolkit. And the idea for this tool is to actually drive a user through a workflow in a GIS system with a GUI to make it as simple as possible, but to allow them to start off with a selection of indicators, which is an extremely important part, using either our databases, pulling from the GEM platform, the OpenQuake platform, or using their own data. Not all data is created equal, so we give the user the opportunity to transform this data via various transformation functions such as z-score, scaling between minimum, maximum, 0 to 1, just simply ranking data as an example. We also give the opportunity to do multivariate analysis, but also weighting and aggregation. Weighting is a really important one. You may want to have your stakeholders sit around a table and decide what makes one variable more important than the other. Potentially income is more important than being elderly in terms of risk, for example. And these variables, we have created the opportunity to be able to do such things in one tool, no longer having to have a separate GIS, statistical software, Microsoft Excel, but now it's all put together in a one-stop shop. The next steps are essentially linking to other variables, linking to the physical risk is an example of this, but also to outside variables for validation purposes, and also presentation and dissemination. I have one slide on this, and this is just basically taking a look at the tool, using Portugal as the example. But this tool, just through the simple GUI here, allows you to develop your model structure. Say an example would be a hierarchical model when you look at just population aspects in isolation and economic variables in isolation, but you still mathematically combine the two later on down the road as separate sub-indices. And this GUI allows you to actually do this with just simple clicks of a button, and also assigning weights or aggregation schemes just with a simple click of a button, and your results are output. One of the final steps to this is to create your model within this integrated risk modeling toolkit, but you have your GIS experts and people who are familiar with the model development, but the disaster risk manager, the decision maker, may not be. So we create the opportunity to take these models that somebody created and to actually upload this into our OpenQuake web platform, and to actually view and to be able to manipulate and explore this data on the web. And here's an example using the same Portugal data to actually look at the risk. This is a district and the municipalities within a district of Portugal, and you can see the distribution of the social vulnerability, which is the blue line, across these different municipalities, but also your average annual loss and your integrated risk and how these kind of interplay with each other. So you can pinpoint right away the areas of the highest potential loss and highest social vulnerability. And the tools allow you to dig down and do this at various different levels, even looking at the individual variables such as the percentage of poverty or population density, for an example. So finally, how are we focusing on using this vulnerability and integrated risk concept for actual decision making? One area that I'll start with is saying that I'm showing you this indicator approach, but these indicator approaches aren't without flaws. You're often using secondary source national census data that may not really be getting at this complex, as Ross has kindly pointed out, extremely complex concept of social vulnerability or resilience. How do you measure culture with a census variable? How do you measure decision making? How do you measure the ability to evacuate? It's difficult to do. So we've come up with an alternate framework for really looking at resilience management as a whole, and doing the assessments from not a top-down approach, but from the bottom up, starting with the community and the leaders themselves. So this methodology actually starts through the selection of stakeholders. And moving on from working with the stakeholders to really try to understand what are the gaps in resilience, and this can be done through a scorecard, which is essentially a questionnaire. I'll talk a little bit more about this and the development of the scorecard. Once you understand and you've worked initially with the stakeholders to understand the gaps, you can look in more detail these gaps, and this is our step 2, essentially, looking at systems measurement. And this is where OpenQuake comes in, to start to really dig down deep to understand the risk, but also understand these elements of resilience. For example, the application of building codes or ability to apply building codes is one area of study that would come out of this gap analysis, and this is something that they're working on in Nepal actually right now, is in-depth building code studies. Finally, the last step is development of performance measures. The actual development of the disaster risk reduction protocol itself, the identifying of the stakeholders to do that with you, and the ability to benchmark and to follow up to kind of close off the cycle. We've put the first steps of this framework into motion, essentially, working in close collaboration with NSET in Nepal, and to develop a scorecard to be offered at multiple levels. When I say this, I mean multi-scalar, multiple levels of geography, but also multiple levels of government. What sets this apart from some of the scorecards that are already in existence is this multi-level, but also the ability to start off with the stakeholders right away and to develop your own resilience program together. The questions that we ask are based on the HILGO Framework for Action, but also the UNIHCR 10 Essentials of a Resilient City. And these are some of the key dimensions that we're looking at, such as legal and institutional processes, understanding social capacities, which is an add-on that we put in there, but also looking at critical resources, the ability to plan, the ability to mitigate, and so on. There was a workshop that took place sponsored by the city of Lalitpur in Nepal, also co-sponsored by NSET. A very successful workshop, and we started off the methodology with representatives, local level representatives from various wards. There's 22 wards in the city. At this workshop we had 19 of them, so a great geographical representation of officials, and we administered the scorecard to them. On day 2, we did the same thing, but we administered the scorecard with the city. So you had the heads of various departments, such as legal and planning, those who have a stake in disaster risk. Then we brought them together to be able to discuss the risk, because one of the beauties of this approach is it facilitates discussion. And we had essentially handheld receivers and linked to a base station, so the data collection was on the fly. We were able to show them their results on the fly and let them discuss and talk about it. What you see here is a graphic that is comparing the actual results of the city and the wards. The different colors are the different categorizations of questions that we ask, such as awareness and advocacy. The different numbers that you see going along the scale of the graph are different question numbers. And then you see vertical numbers going from 1 to 4, and that's basically an average score scaled from 0 to 4. The green is the actual results from the metropolitan city itself, and the purple is from the wards itself. What you're noticing here is a very interesting similarity in the results, except that the city tends to overestimate their resilience. They think they're doing better than the people that are there in the communities are actually thinking. And this is great cause for discussion. What we've learned that's really come out of this so far in Lalitpur is they now have taken ownership, and it's great that Amod's here, because Amod and Dixit can talk a little bit more about this than I can. But it's really allowed the communities to take ownership of their risk. And now they're starting to ask questions, and they're starting to engage this municipality and starting to say, look, we need training programs, we need more work as far as building codes and building code compliance. We need these things, and we're gonna speak up, and we're gonna really fight for these issues. This is just my last slide, and it's showing, okay, we can compare the cities, but this is comparing 2 wards against each other. Now you see a very different distribution in their answers. So why not discuss this? Why not understand why ward number 4 is doing better than ward number 7 in some aspect, for example? Essentially, this is what I have. This is the culmination of the 2 years of work, and we of course intend to carry on in a very similar manner in improving the tools, improving the data. We have the Asia Pacific region data, but we're also doing the same thing for South America and Sub-Saharan Africa as well. So we're going to continue to build these social and economic databases. We're going to continue to improve the tools to make them more user-friendly, but to also make them more statistically robust. Then when we'll continue to do various use cases, Nepal's a great example. We want to continue working with Nepal. We want to take this scorecard approach and apply it at various scales, at various different contexts and social contexts, because what's happening in Nepal is going to be very different from something that's going on in San Francisco. We need to learn and we need to understand to develop better methodologies. Thank you.